is just a little bottle that you fill with warm water with a little spray on the top. If they've had a vaginal delivery, then after delivery, when you first get them up to the bathroom, you take them in the bathroom and you teach them to use the peri bottle, especially if they have stitches. If they had stitches of any sort, and it's very irritating to wipe after you go up to the bathroom. So what you teach them is until the stitches come out, it's usually 10 to 14 days, they're going to just fill the bottle with plain ordinary warm water, and each time they go to the bathroom, from front to back, you just aim and shoot. And then take the toilet paper and pat dry. Don't try to rub, pat dry. And then after they do that, you're going to put on the diaper pad and an ice pack. They've had a vaginal delivery. This is a pack that will contain chemical ice or be cold to help reduce any swelling that they have. Okay? So it comes inside a package, inside a plastic package. While it's still in the package, bend it until you hear it crack. And this one's been opened several times, so you can't hear it crack. But it cracks. And then you shake it so that the ice gets generalized. And then you look at it. This one doesn't have it, but the ones that have it always cough. There's a blue stripe down one side and it's plain on the other side. The blue stripe goes against the diaper. The plain side goes against mom. Okay? If they're sitting on a commode, then what I do first, after they've used the peri bottle, is put the pants on their legs up to about their knees. And then you put this in as mom stands up. Obviously you're wearing gloves. You put this on your patient. You're teaching them to hold the front edge of the tube. They stand up. They put it between their legs appropriately. And then they pull up their pants. Now, if you're doing this in the labor and delivery rooms when they first get up, knees are a little strange. So what I have moms do is after we've got that adjusted, I have mom hold the front and back of that pad, and you, the nurse, lift the pants up. I don't want any patients bending over to put on their pants. But too many of them keep going straight to the floor. Okay? They lose consciousness. They get dizzy. Okay? So you pull them up, let mom adjust herself comfortably. Wearing the pants. Okay? Now, if you have a patient who has a C-section, she's lying on a stretcher, she's not going to be getting out of the stretcher or getting out of bed for 24 hours. So when you go to clean her up, you use the peri bottle. And what I usually do to clean up moms is I have a towel in one hand, and I wet one hand of the towel with hot water, and I give it to mom, and she can wash her face, her hands, and the top. Just feel a little bit more comfortable. Then I use the peri bottle, and when she's finished with the towel, I just wipe down legs and everything also. Then I have mom lift her hips up, and I slide these, and it will not be a sanitary napkin with ice in it. It'll be a plain ordinary sanitary napkin inside the pad. Slide it under her. Put these on her feet, pull it up. And then she lifts her hips again, and you get the pants behind her. Okay?
What's the term for the fluid and blood that comes out of the...
Lochia. L-O-C-H-I-A.
What's the difference between the amount of lochia for somebody who has a C-section versus a vaginal birth?
Well, vaginal delivery, when the baby's out, the placenta's out, the practitioner is going to do a little pressure to get anything that's immediately there. Okay? Patients who have vaginal deliveries are more often more vertical after the delivery. They're sitting up, they're breastfeeding, they're eating, whatever. And so when you push down, they may have a little more initial lochia. C-section patients, when they're still in the operating room, they've got the baby out, they've finished, they've sewn everything up, and the practitioner does a real push. I mean, we say gushes and gushes and gushes for the moment. And then you clean everything up, move the patient to postpartum on the stretcher. Then you may not see much lochia because most of her has been emptied, and whatever develops may pool in the back until she stands up the next day. Okay. Any questions on any of this? Okay.
Yeah, I have a question. In terms of excessive lochia, they were saying that if you change the pad more like every 15 minutes, that it's considered excessive, or more than once an hour. Is that accurate? Like, I mean, how
Fairly.
much?
Fairly. Ask your nurse. A vaginal delivery is expected to have no more than a 500 cc blood loss. C-section delivery is expected to have no more than 1,000 cc blood loss. Anything over that is considered a hemorrhage. So if you have a vaginal delivery that had 1,000 cc's of blood loss, that's a hemorrhage. If you have a C-section at 1,000 cc's, not kind of high, but still normal. Question.
Isn't it also the consistency of the blood as well?
Say that again.
The consistency of the blood? Most people.
The H&H has to get pretty low before we transfuse people these days. We've had patients upstairs with H&H's 20 and 7. That's pretty low. And they usually encourage protein, they give them iron pills. But they don't necessarily transfuse them. Okay. Yes.
If the person has a C-section, how do you care? C-section.
Okay.
How do you clean? How do you care for it? What do you use?
The
Just
incision or the
water?
perineum?
No, the incision.
The incision, you come out of surgery for the first 24 hours, you'll have a bandage over it. Okay? And one of the things that you will note is how much drainage is on the bandage. Okay? Most C-section patients, when they sit up, they'll get a little line of what we call dependent drainage. That is, a little bit of blood along the lower edge. That's okay. If the dressing becomes saturated, the practitioner gets notified. You do not take off the first dressing under any circumstances. If it's saturated, you put another one on top, and you call a practitioner. You have your nurse call a practitioner. Okay? And when you get up to mother baby, one of the things you'll be teaching moms who have vaginal deliveries, a C-section should not need one. This is a zit span. Okay? And it comes like this. It comes with the basin and it comes with the bag. And the zit bath is to help mom's perineum heal, especially if she has an incision from either an episiotomy or laceration. Okay? What you want to do is to get some of the blood circulating around that area so that the properties of the blood can bring the healing properties to that, all the cells and what have you that help heal incisions and such. Okay? So the easiest way to do that is to use some basic warm water and have the patient just sit with her bottom in the warm water. Okay? This is not a bidet, this is not a cleansing tool, this is not for use bath, it's just warm water. What makes some of the stimulation to help the healing is creating a slight whirlpool. You create the whirlpool by filling the basin with warm water. Okay? For those of you like me who are technologically challenged, the word front is written here. It tells you which way it goes into the commode. You lift up the sheet, you put this in with the warm water in it, and you put the sheet down. Okay? Now, these 3 channels in the back doesn't allow any overflow. This channel in the front, for me, is controversial. Once you've got the warm water in there, you're going to fill the bag with warm water. And it's just a little squeeze bag. And you fill it with plain, ordinary warm water. Before you fill it, you make sure you close the clamp. Now, in the hospital, you have hooks everywhere, so you're going to hang this up on one of the hooks in the bathroom. The higher you hang it, the faster it flows. And that's what you tell patients. And that's what you tell patients. When they go home, most patients don't have hooks all over their bath. The easiest thing to tell them is take an ordinary hanger and the hook of the hanger, put the hook of the hanger here and hang it on their towel rack. Okay, they hang up and down. If you fill this with warm water, you hang it up, and then you're going to aim the other portion, not directly to the perineum, but just under the perineum, to the surface, just below the surface. There are various ways of doing it. Most people, you're told to do this, and put it in here, and then fill the basin with warm water. For me, that's very complicated. I usually tell the patient, just hold it, and they can aim it right here, toward the, just under the perineum, under the water, and it creates a little whirlpool. And they just sit, and they can open the clamp then. They can open it either all the way or part way, depending on how fast they want to do it. And they should sit in it for about 15-20 minutes, 2 or 3 times a day. okay? And for me, I've always told, when I teach childbirth classes, I've always told them, just hold the thing. You're not going to be doing anything else for 15 minutes. Just sit here and hold the thing, okay? And aim it, and you can move it around a little bit. One particular side or the other, perineum is irritated. Sitz baths we start usually about 24 hours afterwards. The ice packs patients get after vaginal delivery, we keep them on ice packs for about 24 hours and they switch them to regular sanitary napkins. Patients are welcome to use their own sanitary napkin. I usually suggest they use our pads. Labor is efficient, but it is not neat. So
So sitz box